Welcome to Health Talk. Today we have with us Dr. Robert McKean. He's a general surgeon, board certified, specializes in weight loss surgery. He is going to tell us a little bit about weight loss surgery today. He comes from Good Samaritan Hospital, San Jose, California. Welcome.
Thank you, Gloria.
Okay. So tell us, what is weight loss surgery?
Weight loss surgery has been around since the 1960s, and it's primarily surgery operated on the stomach or the intestine to create a situation where people can lose a significant amount of weight and regain their health.
Now, weight loss surgery has had like several fancy names. They used to call it gastric bypass surgery, and now they have something called Duodenal Switch and lap banding. So I understand now they have it where you don't really make an incision on the skin anymore, where you have just laparoscopic or small incisions.
Small incisions, yes.
So tell us a little bit about that.
Basically, laparoscopic surgery is very common for many abdominal surgeries now. It allows us to operate within the abdomen through very small incisions using very long instruments and a camera. Specifically with these procedures, there will be 5 small incisions in the upper abdomen, about the length of a fingernail. And the surgery itself then is done within the abdomen and takes anywhere from an hour to 2 hours. And this allows the patient to have a much faster recovery.
Now let's start off with the old tried and true, which is gastric bypass. That's been around the longest.
It has. The switch, the duodenal switch and the gastric bypass have been around since the 1960s, 1970s. And the idea with the gastric bypass procedure is to create a very small stomach. The stomach itself, if this is our stomach, out of that we make a thumb-sized stomach and then bring the intestine up to it. A picture like this has a bit of a diagram, but the idea is that with a very small stomach you can feel full with just a very small amount of food. People are much less hungry in general. And it's hard to eat certain things. Things that may make you heavy, specifically sugary things or greasy or fatty things, actually make those patients ill. And so there's a great deal of ability to be full in a very small amount of food, but also be able to stay away from things that make people heavier.
So what happens with gastric bypass surgery is that you take the stomach this size and you're basically going to use 1/3 of it.
Actually about a 20th of it.
A 20th of it.
Yes.
And then you hook up the small intestine to that part.
That's correct.
And then that's why they call it gastric bypass.
Bypass, yeah, because you're bypassing 95%
the rest
of the stomach, yes.
Now with that you get some complications or that people have to get used to.
Well, it's harder to eat certain things, and people have to learn to eat with smaller bites, to chew well, to eat more slowly, and to eat a very small volume of food. If they eat too fast or too much or too big a bite, they may even regurgitate.
Now, it has wonderful results, like within 7 months, 65% weight loss.
Yes, patients within a year or so will lose about 80 to 90% of their excess weight. And that holds true long term for about 85% of patients.
And they also get rid of their diabetes.
Yes.
And their hyperlipidemia.
And their high blood pressure, heart disease, asthma, arthritis, sleep apnea. So a whole slew of things that are caused by weight.
Now, what's the rate of recovery for the diabetes? It also takes that long to recover from? It takes them a year to get rid of their diabetes?
Actually, no. What's really remarkable is, and this is fairly unique for something like the gastric bypass, type 2 diabetes can resolve in a matter of days.
Wow, that's impressive.
It is impressive, and it's very interesting. It appears that not only the small stomach, but the gut hormones change rather dramatically with the gastric bypass, and very quickly patients have their diabetes go into remission. In general, people need to lose somewhere around 30 to 50% of their excess weight to be able to have something like type 2 diabetes go into remission. For our patients, 80% do go into remission.
Okay, so now in the duodenal switch, here's the large stomach,
yes.
And you basically slice off half of it with stapling.
If this is our stomach, you actually make a long tube or a sleeve out of it.
Right.
And then you also make a very short intestine. And the way I describe these procedures to patients is that it gives people a set of tools that they don't have today. Usually a very small stomach that can make you feel full with just a small amount of food, much less hunger, and some food intolerance, and malabsorption, or where you actually don't absorb the calories that you eat. The duodenal switch gives you all four of those, but it is also a more complex procedure.
Takes longer.
It takes longer, it has a higher complication rate, and it has a higher risk of having malnutrition as a complication down the road.
And so, in terms of malnutrition, you mean that they don't have the right vitamins and nutrients and they might get osteoporosis?
Yes, a whole slew of things that either vitamin deficiencies, protein deficiencies, iron deficiencies, and those can be difficult to deal with because sometimes even supplementation may not work.
Now, the same malabsorption will occur with the gastric bypass?
To a much, much less extent. About 5 feet rather than 15 feet of the intestine is bypassed in the gastric bypass. So there is some supplementation. Patients need to take calcium, vitamin B, and iron on a routine basis.
Okay. Now, the most popular one now is the lap banding, the least invasive. This is really popular. Tell us a little bit about that.
The lap band, there's several bands around the world. They've been around mostly in Europe, Central, South America, Australia since the early 90s, and was brought here to the United States in 2001. We now have 2 bands available here in the United States. Bands are very similar in design. They have 2 components. They have a band or a balloon component, and they have a port or reservoir that can accept it.